So on the very last day of that class, everybody left, and she walked out to the car with me. I thought, well, that's very nice. She said, I'm not going to have you continue. And I said, what? And she said, I don't think you'll ever be able to do anything with this, and I just wouldn't feel right in training you. And I remember wondering, she has another girl on Friday or something. Anyway, I said, I can't believe you're saying, you just learned this now on this day at this moment, you're telling me this? And she said, I just think it's best. And I said, again, I don't know where it comes from. I said, well, I'll show you wrong. Because I could tell I had an aptitude. I'd never touched a body like in my life. So I went to massage school, and I started massage school, and they made me a teacher right away.
What do you mean right away? Like
yeah,
you, went,
I would
you
learn
opened
something.
the door and you...
Yeah, and they would have me teach the next person. It was, and so then I started teaching massage at Esalen for the people who wanted to become Rolfers.
Right. Oh my goodness.
But just on the weekends I was there. But anyway, so it was one of those things, and I thought, well, I evidently have some sense here, so she trained me.
Wait a minute, she meaning who?
Dr. Rolf trained me then. So
Well, she trained you then. I thought you were finished.
no, it's 7 weeks
Oh.
of auditing,
Oh, I see.
and a few months later, 7 weeks of training.
So she let you come into the training?
So I heard she was going to be in Los Angeles, and so I had gained some weight.
Mm-hmm.
I had a check made out in full for the entire training, and I had completed my massage school. So I walked in my best Rolf line. Do you know what the Rolf line was?
Yes, I do. It's very, well, you want to show us? It's very
The feet are
erect.
close together.
Yes. We want to face the couch. Yes.
Waistline back.
Waistline back.
Top of the head up.
Mm-hmm.
Chest forward.
Yeah.
Straight ahead. Chin in, not up.
Yeah.
Elbows out. And you walk engaging the psoas and the elbows. So I had the check in this hand because I'm theatrical. Had the check in this hand, had gained the weight, and I walked across the room, and she burst out laughing. And
Because
if
you
you've ever
did the-
heard Dr. Rolf
She never laughed.
No, she had the greatest laugh. She had the greatest
But she only laughed
laugh.
3 times in her whole life.
I used to love to make her laugh. I would do.
Oh, good for you.
Yes, and it was a pleasure because she had a great laugh. She said, "Okay, I'll train you." Anyway, so I trained, and what was interesting is I created a movement program based around her rules, what she thought movement was, and her paradigm about alignment, and the medical model as well. And then I started having a problem.
How far in?
Really, I started training people. My classes were required for all Rolfers from 71 to 77 when I left, but I started disagree. You know, it's one thing when you disagree with somebody else.
Yeah.
You can usually justify, well, they maybe don't see this or this.
Yeah.
But when you hear yourself say something in class and you go, I don't believe that. I don't believe you hurt people to help them.
Yeah.
I don't believe people are recipes, and I don't believe that good posture and movement has anything to do with holding it. So a lot of the medical model was doing dynamic movement. This was dynamic movement. Tuck and suck and walk holding that. And that was called dynamic stabilization. You know, Joe Montana, et cetera, et cetera. And so, as you have pointed out, it's about this time that I begin to realize there's something in me that I'm using as the index for evaluating truth that I haven't known was there. It just comes that I see what I don't agree with.
Wow. And how old were you at this point?
I was 26. I started creating these programs, 27, 28. Late 20s when I had the disagreement with my own teaching. And about the same time, someone at the community college, because I taught there till 72, said, we can always tell your dancers they dance just like you. And I remember going, oh no, I wouldn't want that. How did I let that happen? And so suddenly all the walls about posture and alignment started breaking down.
Wow.
And I tested it. I would walk into a room where I would teach, and people would go like this. And I would just play with them sometimes. I would walk out as though I forgot something. And I'd quickly turn around and come back in, and they'd be here. And I'd say, see, this isn't working, is it? And they'd go, well, but we're supposed to sit like this. I said, no, if we were supposed to sit like that, we would have figured how to do it without effort.
Mm-hmm.
So that led me to the next thing and the next thing, and I realized that, and people started saying, you know, this is heresy for you to say that bodies are supposed to be asymmetrical and that they're not supposed to stand in that way and you're not supposed to go in at right angles, you know. And I said, well, I have had the great fortune that Dr. Rolf asked me to work on her. Her son worked on her, and she asked me to work on her for a certain period of time. So I gave her sessions of body work, and she really liked it. So I thought, well, this is good. I guess I'm here to help Rolfing in whatever way I can. This is great. I felt very on board.
Wow.
I then realized that Donald Music, do you remember?
Yeah.
Yeah. Donald was a little boy that had drowned and was brought back to life.
Lorenzo's dad. Wasn't that Lorenzo?
I think.
Lorenzo Music is his dad.
Oh, wow.
Yeah.
Okay. Yes.
I'm pretty sure.
Yes.
Yeah.
I think so.
Yeah.
And I just mainly went and worked with him and left, and it was this life-changing moment or confirming moment. And his pattern, having been with the atrophy and the spasticity, his pattern was in this kind of unmovable, catatonic, well.
And he was how old at that time?
He was 4. This had happened when he was 2.
Mm-hmm.
He was, I
remember
think,
that.
4,
Mm-hmm.
3.5, 4. And I went in, and Emilie, I saw for a body that has all of this going on, he had all of these whole spaces where he was unsupported.
Mm-hmm.
And intuitively, I ran and I got this towel and that pillow, and I stuffed him in all the little cubby holes.
Mm-hmm.
And he went and closed his eyes, and I went, oh, this is it. He just said thank you or yes or hello or something. This was important. So then I tried my techniques, and I rolfed him, and I stretched, and I pulled, and I stretched, and I pulled, and I could feel I was tightening his hand.
Mm-hmm.
So I went, well, there's something else here that I've been playing with, which is what I call matching. So how about I'll just do it. So I matched exactly the vector line, and I felt the direction that it went, and I just supported it in that direction. And I could feel it a little bit change, and I took it a little bit more into that. And when I would release, his hand went from there to there. And I went, this is a big change, a 1/4 inch change.
Well, you know, can we stop right here for a second? Okay, because one of the things that I appreciate in relation to what you're speaking to is what I call the homeostatic insistence on the perpetual pattern, no matter what it is. And the fact that you were able to match and titrate very small, because a person can manage that.
Yes.
What they can't seem to manage is a large upheaval in the system. It's going to go into a giant recoil. But you matched him, you came to meet him in his language, and then made a tiny adjustment. And his system was able to receive that. And that's just huge.
It was very huge.
It's huge. You see, but the thing is, I just want to just say that countries function in the same way, that revolution is too abrupt. Large change is usually not tolerated, that the incremental shifting is tolerated. Mm-hmm. This is a big issue.
It's a big issue.
It's a huge issue.
And this is our world. This is our world. We are the microcosm of all that could be. This is the learning ground, isn't it?
But you see, what I think is so important about what you're describing also, we talk a lot about mirror neurons. Are you familiar with that? Well, mirror neurons are something they've just been, recently identifying as when somebody does a movement, the other person can get it.
Yes.
And so when you were doing this, what you call matching, it's a kind of a mirror neuron thing.
Yeah.
So you're able to not be alien to what he's experiencing, but you're immersed in the quality of what's going on, and then the suggestion, very subtle suggestion, can come in. But he feels met.
Right.
So he feels the coupling.
Mm-hmm.
I mean, that's just a huge thing, because what you're describing earlier is a kind of militant approach. I mean, would that be too drastic a word?
Well, it just, I think anything that, when you push, something will push back.
That's right.
Is that the layer you want to be pushing back? There's a way of toning the body where you create a little bit of resistance, but that's very different than I'm going to compress layer after layer after layer after layer, and to get to the deepest layer, and that would be better than knowing how to listen to the tissue, because all tissue has a tempo, a direction, a layer, and pause that will tell you how to match and meet it. And when we meet it, the truth of that, when we hang out with it, my experience is the truth of that will tell us what direction to go.
Well, see, here again, the issue of you not following a grooved pattern, but of listening and being able to be directed by the moment that's occurring, rather than insisting on a theory.
Right.
I mean, don't you think?
Yes. Well, and then the theory would emerge. So that's what happened with Donald. It was like, when I finished, his hand had actually opened this much, and he did one of those again, like that. And I said, "Oh, Donald, thank you so much for this gift you gave me." And I left. And shortly after that, I was walking in Tiburon, and I sprained my ankle. And I said, "I know about this. I can either sit down on the grass and scream for the pain, or I can match what happened and then reverse it. Why not? I'll just give it a try." So I sprained my ankle. I stepped on, and it was grass, and there was evidently a divot or something, and I sprained my ankle, and I remember that my arms went up like so, and I started to reverse it. So I went back. People were walking by going,
They were
crazy.
laughing.
They were like, just another weird person. Anyway, so I'm here, and I'm trying to create the exact line of force to the pain that happened there so that I could match it and slowly retrace backward until I was directly on top of, and I was able to walk, having sprained my ankles many times in dance.
Wow.
That would have been one of those, the ice, the this, the that. But because the tissues got put back in place with weight bearing and functional, as in movement, evidently I didn't have the consequence.
Wow.
So I thought, okay, thank you, I'll just start playing with this. So I did. But the point is, it gave me the opportunity to test this theory that was coming. And I created this whole bodywork called arthrokinetics, which is the way you spiral into the tissue, and you can work the front of the spine, you can work the diaphragm, you can work the pelvic floor, places you can't touch, by knowing how to spiral and move the person to get in there. I know you know from your work. Anyway, it was just, it just grew and grew and grew, and became the theory that I started to play with. I came back to Sausalito, where I lived, and this woman I'd been working with, her legs were different lengths. And I said, we always try to get you to lengthen your short leg or bend your longer leg. How about you just match your short leg? So she's walking down my hallway, and I said, "Susan, is your right leg getting longer, or am I imagining it?" She said, "It is." I said, "Well, this is kind of interesting." So the next day, I'm saying all bodies are asymmetrical. If we're supposed to be symmetrical, I would have seen at least one body in my lifetime by now that's symmetrical. So I walked by, and the wind had evidently blown my anatomy book open to the lungs, and I went, there it is. The lungs are different in number, different in position, different in density. I think there's only 2 ounces in weight. But the fact that these are longer, narrower, but deeper. And I started to notice that people were centered closer to their left foot more than their right. And that the right side rotated around the left more, et cetera, et cetera. That this would be a kind of anatomical tendency. If you take anything that's asymmetrical from one side to the other and you put it into motion, it creates a spiral. So there are ways to match. There's an ascending spiral, a descending spiral, a all-directional spiral. And I started playing with that, and boy, change just started happening like that. So people wanted to learn it. I started to teach more. And
I've been very interested in your whole notion of three-dimensionality. And I'm wondering if you can speak to that, and how did that arrive for you, and more.
Okay, yes. So many of the Rolfers then that had trained with me wanted to continue. So they started to take more classes in some of these ideas and change their work, and were very appreciative that they had to work less hard, get better results and happier clients for what they were able to learn about how they use their body. So I was so pleased about that. But this idea about the math of the body and the alignment, about this plumb line, the plumb line was driving me crazy. And I said, I don't even, this is something that you and I would be talking about over coffee, I think. I'd say, Emilie, that plumb line is all wrong, because it shows a plumb line coming from the sky, and the plumb bob is able to move this way, and the body is the opposite. The body's attached to the feet if we're standing, and the head can move. So it's reversed. This idea doesn't work, this plumb line. So then I started looking, and I realized, if you put, I don't know if you want to stand and do this with me, but if you put the line between your ear and your shoulder and your knee and your ankle, the plumb line, it puts your weight on the back third of your foot.
Right.
So I said, why do we have a forefoot?
That's right. Why do we have a forefoot?
I'm here to tell you, we're supposed to have a forefoot. And so I would make a joke. Are we supposed to have an aft foot? If that's the alignment pattern, we should have an aft foot.
That's right.
Exactly. But now, let your legs just be open as yours naturally are.
Okay.
Just there. And bring your weight to the whole foot. And it's about 2 degrees forward or so.
Yes,
3.
it is.
That's the new alignment. You use the whole foot.
The whole foot.
And so what happened?
Oh my God.
The whole foot.
It's like Newton.
Exactly. The whole foot allowed the body to become more three-dimensional. And I noticed when the people went into a straight line, plumb bob and so on, the chest would get shallow and they'd have to lift it out. And they would lose their dimension. And when they did this other, the body would deepen and lengthen and widen. And I said, the body's three-dimensional. We should really be teaching how to keep the body three-dimensional. So I started to teach people to look at shape instead of landmarks.
But I want to stop you here for a second.
Yeah.
When you watch somebody move, you also watch how they think. How they create the world is through their movement.
Yeah.
So when you're talking about the difference between adding dimension, that's also how a person would see the world, is in having more dimension to it.
Exactly.
So that the correlate between how it is that we're moving and how we're aligned in whatever way that we are is going to determine the world that we are constantly creating.
Exactly.
So
it determines our perspective.
Yeah.
Yeah.
Yeah. So I mean, so that's a huge thing, is the shifting into this dimensional, a whole world that you're describing.
So I ask people, please consider the internal volume of any part of the body. That the body should be so natural that for you to have a deep chest isn't because you borrow from your back. Or for you to be long isn't because you're pulling yourself up and going on hold. There's some way that the internal, all 3 dimensions, can be full, resilient, and functionally very supportive and easy. So it became a different way because everybody taught the plumb bob and the straight lines, and if your shoulders aren't level. And I would have people walk in and say, I bet you can see my shoulders are really bad, right? I mean, one is really high, and I go, I've never met anyone that doesn't have a shoulder slightly higher.
Well, okay, let's pause here also. You're talking about having a map of an idealized body, which doesn't really exist.
It all comes from the person.
Yeah, so the shift of imposing.
Exactly. So matching what is. So some people, because they have a pattern of history from a limitation, a surgery, a crushed bone, and so on, this is their neutral.
Yeah.
But when you can teach them how to maximize their neutral with momentum and juiciness and spiraling movement, as opposed to, I'm going to make them walk the way, I'm going to tell them to walk the way as if they didn't have any limitation, which is what happened when I had my accident. One of my hats that I love, that I've worn for most of my life, is as an inventor. And I'm a charter member of the Nevada Inventors Association. And I would go and show some of my product ideas, which I had 175 in 1983. But anyway, and the patent attorney that I went to, he said, he was overwhelmed. I took the 175 ideas for him to look at. And he said, I actually can't talk to you about this right now. I have to think about it, but I'm going to call you back, okay? So he called me back and he said, I have good news and bad news. I said, yeah, I'm familiar with this routine, whichever one you want first. He said, the good news is it seems as though you've discovered a law of nature. The bad news is you can't patent it.
Because?
It's a law of nature.
Oh.
But he said, I can help you patent each product. So I started. It took me 5 patents to get my one handle.
Okay, but I want you to take us back because you're talking about this. You're talking about, asymmetrical, and then you started to talk about the music little boy who you
matched.
Well, you gave him little supports to work his body out. So take us into how you design these products. In other words, how did that begin to arrive?
Well, one of the things that would happen is I would work with a client, bodywork, movement, exercise, etc., and they would look a certain way and move a certain way when they finished. Mm-hmm. And they'd walk over, and I'd be writing on their chart to remember that we did this, this, and this. And I'd look over and I'd go, could I see you get back out of those shoes? Uh-huh. And they'd step out of the shoes, and there they'd be. They'd put the shoes, and I go, the shoe has a negative heel, they're in a hole.
What do you mean by a negative heel?
The heel is lower, quite a bit lower than the arch.
Is that the Birkenstock?
Many shoes. Birkenstocks, shapers.
Uh-oh, we're going to get into Gestalt therapy,
et cetera. But, I mean, they do what people do. They do what people say they do. They do rock. Mm-hmm. The question is, should the foot have a natural position and rock through its own range of movement, or should it be held in this rocker? Mm-hmm. And etc. So people can explore that. I would follow people out sometimes to the car, and I would see them get into their car seat, and I'd say, wow, that's the very thing we just worked on getting rid of. So I started using duct tape and foam and towels. And it was hilarious because this one day I walked out with this man to his Jaguar, and I had the duct tape, the scissors, the foam, etc. And he said, excuse me, what are you planning to do?
You're going to kidnap me? What are you doing? Oh,
and
my
I
God.
Said, I need to modify your car seat for you. He said, you're not touching my new car. And I said,
my Jag.
Not my new Jag. And I said, oh, okay. He said, do you really feel that it's that important? I said, it's that important. He said, okay, I'll send you the upholsterer. You tell him what to do, and you can rebuild my seat. So I decided it was time for me to start making products. So that's when I got into making the products to help people have a choice for where their limitation, their interest, etc.
Well, I always think about your war with furniture. and rightly so, by the way.
Yes.
And did you ever, I mean, is part of it furniture?
Oh, indeed, baby furniture, equipment, sports equipment. Years ago, I won the opportunity to go to a group of venture capitalists out of Stanford University. I was so excited, and I had a list of products, and they said, oh, these are too common sense, people won't buy them. This was '83. One was triathlon bars, one was the front support chair, and one was the split keyboard, but it had certain choices for the body pattern, not that you would just create the person here, and then you change the keyboard to here, and their body doesn't change. But anyway, I didn't win, and so that was that. But at my inventors group, someone brought a pair of skis that have ball bearings in gel. It made them weigh 3 times a normal ski. They had no ski to the back and just to the front. And the idea was you'd never torque your knee because you didn't have anything to the back to do that. And you could do ballet, and you could carve easily because when you turned, the ball bearings would go that way. But the binding that they used did not release with this heavy ski.
Uh-oh.
So I'm skiing, usually people's last run, and it was.
I mean, you were using that ski
Mm-hmm.
when you, oh, shoot.
Mm-hmm. So I hit ice, and I heard a, and I went, well, I'm strong enough. I know I can just jump uphill with my other leg. And I did. I jumped uphill, but the momentum took that ski that weighed the ski that weighed so much, and swung it 180 degrees and broke my leg across right here. And in the air, the tibial plateau bone moved, and when I hit the ground, it split the tibia vertically and crushed the knee.
Oh, my God. And what, excuse
93.
me? Oh, yeah, I was just going to ask. Okay.
93.
Oh, my God.
And a compound fracture, and they had to rebuild it from my pelvis, and you have all these consequences from various things.
Yes.
But, and I was out of my body basically, I think, for a year.
Yeah.
I just kind of left, and people were shocked because I would say, would you move the leg is hurting.
So why?
I depersonalized, it was the leg.
I see. Uh-huh.
And one day when I was receiving work, and Brian was my therapist.
Your husband.
Mm-hmm.
Yeah. Your husband, Brian.
Blessing of my life. And he, working, and I said, oh, my leg feels so much better. It's like
My leg.
I had felt this right back through the solar plexus.
Wow.
I rejoined. And it was interesting because I was required to do traditional physical therapy. And the physical therapy...
Well, excuse me, because of insurance?
Mm-hmm.
You see, that's the Kafka moment. That the insurance company doesn't know anything at all and will only insure something that is marginally helpful.
For a certain number of visits.
Exactly.
Mm-hmm.
I mean,
Certain
so that's
content.
the Kafka. Yes, we want to put that down as the Kafka moment. Yes.
So I had these long 8 screws going through here and a plate here and this and so on and so forth. So Emilie, with those screws and plates, my leg was held in from the femur, and then the lower leg was lateral to that and torqued like that, okay? And the tibialis anterior was bulging because the bone had come through, and anyway, it was not good. I think I called you shortly
I think you did.
after I got on.
Yeah.
Mm-hmm. Anyway. And they did the physical therapy with me and so on, and there were many things that I'm sure could be helpful, but the idea that I should try to perform beyond the ability of this area was not okay with me. So the idea was that even with the crutches, I should try to be moving this leg in a normal swing across like so. And what I realized is if I did not start to get weight and juice and impression and traction, movement into all of those little places that had been held, I would never reclaim. So this is how my gait had to go. This is how they put my leg back together. So I'm quite short on this side, etc. And they wanted me to walk like that. That would be a better gait.
Excuse me, didn't they have an anatomy book handy when
Then-
they put your leg together?
So they didn't know anything.
But did they know who they were dealing with? I mean, you just played dumb? I mean, what, or you just shut your mouth, or were you so...
I had to check myself out of the hospital. I called a wheelchair company, and I called my husband, and I called the doctor's office, said, I'm rolling myself over there to check myself out. I'm going to die in this hospital. Because I asked for a few things, and they decided that I was not only non-compliant, I was a difficult patient, and they were doing things like not giving me ice because of the swelling being so bad, but they said that the doctor didn't approve it. You know, things like I knew I was going to be in trouble just because I had asked for a certain kind of attention. Yeah, it was very scary. And so I checked myself out. We went home.
So, excuse me, how long were you actually in the hospital?
They kept me there, I think, 6 days, 5.5, 6 days. And my throat was starting to swell closed because I was trying to tell them that whatever that medication was, I couldn't take it. And I just knew I wasn't going to make it out.
So one of those turning points again, where you're not obedient and you allowed your instincts to come forward.
The first, when they moved me, I mean, they broke my leg many more places when they were getting me from the gurney to the x-ray to the gurney to the hospital bed to the, it was just, it was really unfortunate. And the next, during the night, I remember hearing this sound like someone almost with a limp coming into the room. And then this soft-spoken voice came to me. And she said, I have to move your leg. And I said, okay. Let me tell you how to do this. And she said, okay. And she moved my leg, and it didn't hurt any more than it already hurt. Okay? Her name was Susan.
Wait, was it an actual person?
Nurse.
It was an actual nurse.
Night-
Oh, okay, because the
night
way
nurse.
you described it, we
Yeah.
don't quite know. Okay, because you have
Yeah.
so many interesting
Yes.
other...
So the next day, I asked for her. And suddenly, the head of the department brings a team of nurses in to talk with me. And I said, oh, I was hoping that Susan could help me. She said, no, Susan's not here. So what you need to do, and she grabbed my leg and went, boom, like this.
Oh, no.
I screamed, and she said, that's the way you have to do it. In other words, you have to surprise them and get it done and get out.
Surprise them, who them?
The patient.
The patient. Just exactly what our theory is not.
Exactly.
I mean, when we go back to this mating and mirroring and all that business and
Nuance.
nuance and slight adjust. I mean, so there you go.
Yeah.
So did she learn from the Marines? I mean, where did she learn?
It was just one of those moments that the woman Susan came to me later, and she said, I'm so sorry. She said, I can empathize because I broke my leg. And I replayed that I heard this uneven gait pattern that first night. And I thought, it's someone who's been through the nuance of this that understands and appreciates and will let the patient, now many people I'm sure don't know how to direct, but they know how to evaluate.
Yeah.
You say, is it like this? Is this better or worse? Mm-hmm. Oh, okay, how about this way? And you do it anyway, it doesn't take much time.
Wow.
So I rehabilitated, and I was feeling very sorry for myself.
Yeah.
And I was angry.
Yes.
I was angry that I got myself into that. I was angry about how I was behaving. And there was a moment, and this is the piece that I think you'll relate to the most. There was a moment I was so angry at myself and everybody, of course. And I said, and I've lost my dancer.
Mm.
What? That's unacceptable. I can never lose my dancer. And suddenly, I said, this is it. So I'm sitting there, and I've got the soft brace on and the crutches, and I'm looking at my treadmill, and I go, I can figure this out. And I roll myself over there, get the crutches, stand up so I'm unweighted here, hop on with this leg onto the side of the treadmill, and let the start the conveyor belt. And I did it, I think, at 0.1, 2, 3, something like that, or 0.01, whatever the lowest was that I could do. So I would let it pull my leg just ever so slightly, like this.
Nice.
And then I turned around and let it do the other way, and so on. And then eventually I could feel, if I put weight here and let the knee come in, if I do the vertical now and rotate and come in, and pretty soon I could feel the up and down and the right and left and the forward and back, and I knew it was going to be okay.
I can't imagine anybody coming back from that accident. I really can't. I mean, really. I mean, it was...
So I created this whole dancing on the treadmill program, eventually, from the rehab from this, and I went, my dancer's back. My dancer's back.
So how long did it take you? I mean, because obviously you're
I can run and jump and play.
Yeah, so how long did it take you?
A year.
That's all? Now, and did it impact your work from having to deal with such a catastrophic injury?
Well, it certainly gave me a lot more information to problem solve and to ask questions and to apply these concepts. See, I was still applying the same theory of the body's wisdom, asymmetry, spiraling, base of support, three-dimensionality, not just linear compensation. That's not going to be acceptable. And so, yes, it really just enhanced the work a great deal.
So I want to ask you, in terms of how you envision the future of your work. In other words, here we are, and how do you have a sense of it?
I've created so many programs. Like the facial fitness was because someone lost their mother and I watched him age at least 10, 15 years in a week. And so I put this facial fitness. I have all these programs that I have created that I'm starting to train people to teach. And all of them seem to help people become their own teacher, which has been my goal. That you supply people with experience and strategies, so to speak, or enough information that they begin to go, wow, my legs are different lengths, so when I ride the horse, if I change the stirrup by 1 inch, maybe, yep, hey, that worked. I can now feel the massage through my spine, whereas when I was before, I used to always get this pain. So my interest would be to have more and more people be able to teach this so people could become their own teacher.
So it's very interesting, that in the whole lineage of moving legends, the issue of self-empowerment,
very much so,
which is a theme that has been going with Bonnie and Anna and you, and certainly with myself as well. I mean, I just find, that's in a way, that's the lineage of Isadora. I mean, well, so we have to also bless her spirit.
Indeed.
As it moves through us.
Indeed.
So.
All those who have come before.
Yeah.
That we stand on the shoulders, isn't that the saying? All those who have come before.
Okay, so now this is archival. So is there anything you would like to say to those who come after us? I mean, you've said so much, and you have brought so much to this particular time capsule. So is there a final something that you would like to convey?
The piece about trusting the inner wisdom that each person has, and that to springboard off other people for maybe refining it, but to listen and follow through, even though when doors close and people say, no, that's the plumb line's supposed to be here. What's the matter with you? Shoes are supposed to be designed this way. Excuse me, don't you know any better? I just encourage people to listen to the truth that has come through them, because the body's wisdom it carries it all from all before. I'm sure you have this. Sometimes you feel someone comes in and you feel as though I can see the lineage behind them of all their ancestors and their spiritual ancestors. I mean, it's like the room is very full, and we're carrying forth everybody. So I just say, here's to you. Here's to you.
Well, I also would like to reflect the issue that you brought into this time together is the issue of trusting your instincts, of through some incredible gift, because I think it is a gift, of forging into unknown territory, of listening not only to yourself, but to the wider wisdom. Mm-hmm. And the gift that you're bringing into the community and the lasting gift. So I want to thank you so much for being my friend.
Oh, my goodness. Of course, thank you.
Oh,
great. Thank you so much for doing this. This is such a gift. Thank you so much. Thank you. I'm honored. I'm really honored.
Yeah.